First, this slide shows you that our case counts have been going back up over the past couple of weeks. Fortunately, when you step back, you can see that we are nowhere near the number of cases that we saw last winter. And I am confident we will not go back to that point. But cases are rising again, and so are hospitalizations. This is playing out across the country, and it is because the Delta variant is significantly more contagious than previous strains. We all need to understand that Delta is different than the COVID strain that we were dealing with earlier this year. It's much more contagious, and it comes with a higher viral load that can make people sicker and faster. The only way we can beat this virus is vaccination. And it breaks my heart as your governor and as a doctor to see people getting sick, getting hospitalized, and unfortunately dying of a disease that is now preventable for most people, a disease they could get vaccinated against. Almost 73% of Virginia adults have had at least one dose, and 54% are fully vaccinated. That puts us ahead of many other states, especially in the South. But we want more people fully vaccinated because, again, vaccines work. Let's look at who is getting sick from COVID. Our data show that since January, 99% of COVID cases have been in people who were not fully vaccinated. 98% of hospitalizations and deaths have been people who were not vaccinated. You can see that very clearly on this slide. The gray line is all the new cases we've seen since June the 1st. It's actually very hard to see because it's covered up by the blue line, which is the cases among unvaccinated people. The yellow line, which is way down at the bottom, is the cases among people who were fully vaccinated people. So vaccination works. It is that simple. Even though Delta is more contagious, vaccinated people are still strongly protected against getting so sick that they have to go into the hospital. Nearly every single person who has died from COVID has been unvaccinated. As I said, vaccines are the only way to stop this virus and get back to the normal lives many of us were rediscovering just a few weeks ago. And that's why new actions that I take as governor will be focused on promoting vaccinations. So today, I'm taking an important step to protect state employees. We have around 120,000 people who are employed by the state of Virginia. And speaking as the head of that workforce, I want everyone to be as safe and protected as possible. Today, I am announcing that we will require all state employees to be vaccinated and show proof of that vaccination by September 1. Anyone who chooses not to be vaccinated will have to get a COVID test every week and show proof of a negative result. I am directing this measure to keep state employees safe and to keep the people that we serve safe. And I really encourage local governments and private companies to do the same thing. There is no reason why we need to see more suffering and sickness. Not when safe, effective, free vaccines are readily available at your local pharmacy, at the grocery store, at your doctor's office, at the health department, at lots of places in every community. To find out where to get vaccinated, go to vaccinate.virginia.gov. Again, that's vaccinate.virginia.gov, or call 877 VAX in Virginia. And the number for that is 867-829-4682. Now, I want to talk to the people who may have hesitated. Maybe you're worried about side effects. Maybe you wanted to wait and see how other people reacted to the vaccine. But I hope you will listen to me and hear me now. The time for waiting is over. Millions of people around the world have been vaccinated, and we are fine. 350 million doses have been distributed in the United States, including nearly 10 million right here in Virginia. So please, protect yourselves and the people around you. Get vaccinated. We have all seen the news stories and Facebook posts from people who are very sick with COVID, who wish they had have gotten vaccinated. For example, in the news today is Bristol resident Travis Campbell, who has been posting videos to his Facebook page. On July the 25th, Travis wrote this, and I quote Travis, "I truly regret not getting the vaccine. I'm testifying to all my bulletproof friends that's holding out. It's time to protect your family. It's not worth getting long-term lung damage or death. Please go get the vaccine." End of quote. Travis also said in a video that he's over the stupid conspiracies and urged people to be rational and protective, not stubborn like he was. Travis, I am grateful to you for using your situation to encourage other people to get vaccinated. And I sincerely hope that they listen to you, and I hope that you get better soon. This chart here shows our daily vaccination rates, and it has dropped a lot from the peak. But I take encouragement from how that line is tipping back up just a bit. We now have an average of 13,000 people a day getting their shot. So if you've been hesitating, look at this chart and know that you're not alone. A lot of people like you are making the right choice every day to get the vaccine. Do it to protect your family, especially if you have young children. Do it to protect everyone around you, because none of us is an island. We can call vaccination a personal choice, but our choices affect other people. And do it to save yourself. I do not want any Virginian to die, especially when it could have been prevented. More than half of our population is fully vaccinated. More than 70% of adults have had that first dose. Now, many parents are particularly concerned about their children going back to school in just a few weeks. We still don't have FDA authorization to vaccinate children younger than 12, although I am hopeful that this will come this fall, just in the next few weeks. And Dr. Fauci said he expects the FDA to give full approval to the Pfizer vaccine as early as this month. That's great news. Local school divisions are taking the lead, including mask wearing and mitigation measures in their schools. We expect them to follow the law. And the law that was passed earlier this year says that schools will do two things this fall. They'll offer in-person instruction 5 days a week, and they will follow CDC mitigation strategies. The CDC guidance is that people in schools need to be wearing masks. That law was passed by a strong bipartisan vote of the legislature, and I expect school divisions to follow it. If they choose not to follow it, they should have a frank discussion with their legal counsel. In closing, I just want to reiterate how important it is to get vaccinated. As I said, almost all of the hospitalizations and deaths that we are seeing now are among unvaccinated people. That means that for most adults, this is now a preventable disease. So please get vaccinated. Thank you for being with us, and I'll be glad to take questions.
Regarding this K-12 stuff, instead of relying on this interpretation of the law, why not just offer require it and issue a mandate versus, you know, if this is your interpretation of the law, others could interpret differently and lead to a legal fight, as you referenced, potentially referring to their legal counsel. Why not just mandate instead of relying on this GA law?
I'm not sure I follow your logic in your question, Cam, but it is a law, as I just said, that was passed by our legislature in March of 2021 that said two things. It said, number one, that children will be in class learning 5 days a week, and it said that the schools would follow the CDC guidelines. I don't know that it can be any simpler than that. It's the law of the Commonwealth of Virginia, and I expect our school districts to follow the law. Regarding
the state employee mandate, for those who refuse to get the vaccine, and if they refuse the weekly testing, I guess, what sort of, is it an immediate firing? Is it mandated work from home? What are the steps for someone who doesn't want to follow the mandate?
Well, I think it's a good question, and I expect our employees of the Commonwealth of Virginia to follow the law, to follow the mandate. If they choose not to get tested, then obviously we'll take the next measure. But that's something that I'll discuss with the employees.